A nurse is administering a shot of vitamin K to a 30-day-old infant. Which of the following target areas is the most appropriate? Option A, gluteus maximus. Option B, gluteus minimus. Option C, vastus lateralis. Option D, vastus medialis. The correct answer is option C, vastus lateralis. Medications are injected into the bulkiest part of the vastus lateralis thigh muscle, which is the junction of the upper middle thirds of the muscle. Never give an injection in the gluteal muscles to avoid the risk of sciatica nerve damage. A parent calls the pediatric clinic and is worried about the bottle of cleaning fluid her child drank before 20 minutes. Which of the following is the most important instruction the nurse can give the parent? Option A, contact the poison control center immediately. Option B, this too shall pass. Option C, take the child immediately to the emergency department. Option D, give the child syrup of ipecac. The correct answer is option A, contact the poison control center immediately. Rationale. The Poison Control Center will have an exact plan of action for this child. Syrup of ipecac should not be given to someone who swallowed chemicals that cause burns on contact or medicines that can cause seizures very quickly. It can be dangerous to people with some types of medical problems. When such poisoning victims got ipecac anyway, they developed serious complications or even died. A 28-year-old diabetic male has been found wandering around in a confusing pattern. He is sweating and pale. Which of the following tests is most likely to be performed first? Option A, CT scan. Option B, blood glucose check. Option C, arterial blood gases. Option D, blood culture. The correct answer is option B, blood glucose check. Rationale. With a history of diabetes, the first response should be to check blood sugar levels. A patient is admitted to the same-day surgery unit for a liver biopsy. Which of the following laboratory tests assesses coagulation? Select all that apply. Option A, partial thromboplastin time. Option B, prothrombin time. Option C, platelet count. Option D, hemoglobin. The correct options are options A, B, and C. Rationale. Option A, the partial thromboplastin time, or PTT, also known as activated partial thromboplastin time, is a screening test that helps evaluate a person's ability to appropriately form blood clots. It measures the number of seconds it takes for a clot to form in a sample of blood after substances or reagents are added. Option B, prothrombin time, is a blood test that measures how long it takes blood to clot. A prothrombin time test can be used to check for bleeding problems and to check whether a coagulant medicine is working. Option C, platelets, also called thrombocytes, are tiny fragments of cells that are essential for normal blood clotting. They are formed from very large cells called megakaryocytes in the bone marrow and are released into the blood to circulate. A patient is admitted to the hospital with a diagnosis of primary hyperparathyroidism. A nurse checking the patient's lab results would expect which of the following changes in laboratory findings? Option A, elevated serum calcium. Option B, low serum parathyroid hormone. Option C, elevated serum vitamin D. Option D, low urine calcium. The correct answer is option A, elevated serum calcium. Rationale. The parathyroid glands regulate the calcium level in the blood. In hyperparathyroidism, the serum calcium will be elevated. The chronic excessive resorption of calcium from bone caused by excessive parathyroid hormone can result in osteopenia. Parathyroid hormone may be high or normal but not low.